Taking a look at men's health issues as we approach Father's Day, the American Cancer Society says about 233,000 new cases of prostate cancer will be diagnosed in 2014, with more than 20,000 men dying of prostate cancer. Dr. Mark Delworth with the Urology Group joined Jerry Thomas to talk about the numbers.
It's the most common cancer in men, certainly over the age of 50. It represents 14% overall of all cancer diagnoses and about 5% of all cancer deaths.
Wow. And you know, Doctor, I have to bring this up, and it's amazing. I see a lot of it and more of it lately, and maybe it's just the way I've been thinking, but I see news stories that all men don't need to get PSA screenings, and all women don't have to get mammographies. My goodness, it's wasted a lot of the time. That's the general theme of the news stories. Is that a way that the government's been planning stories like that to try to keep people from objecting when they say we don't need to do that test?
Well, the U.S. Preventive Services Task Force came out with some guidelines that actually discourage prostate cancer screening. You're absolutely right. But if you look at the data, we've had a 40% reduction in death rate since we started screening for prostate cancer. You know, PSAs was discovered in the late 70s, and we started our screening protocol in the late 80s, early 90s. And since then, we've really made an impact in terms of the quality of life of men living with prostate cancer and decrease in the overall death rate. So we strongly disagree with that recommendation, and we go with the American Cancer Society recommendation, which is to start screening at age 50 and perhaps even at age 45 for men that are at high risk.
Do you think the government's going to start pulling the plug on paying for tests like these?
Well, I can't speculate on that, but I certainly hope not. I think that we want to continue to use evidence-based medicine to treat prostate cancer in the best way to improve people's lives, and I certainly hope that that's not the case.
Now, for people that don't know anything, when you say PSA, of course, I thank God my doctor, does that check for me. It's once a year, and it's merely a blood test, and you can get a number that they can see if you've got maybe looks like it's going to be a problem, or everything is looking just great, and so on. Isn't that right?
Absolutely. You can throw that in with your cholesterol and your routine labs, and it's a physical exam, and you can talk to your doctor about this, and it's like any screening test. It doesn't mean that you have prostate cancer if your PSA is elevated. All the PSA is, it's a screening test to identify a population that's at higher risk that needs to go on to get further testing, just like a mammogram would identify a woman who may be at higher risk for breast cancer.
Mm-hmm. As my urologist told me, and I didn't know this, and I think men ought to know it, the PSA, if I understood correctly, is a lot like blood pressure. It has spikes up and down, does it not?
It does. It can, in fact, up to even 15% in 24 to 48 hours. And that's why we look at overall values. We look at things called PSA velocity, which is a change over time. So if you start your screening process with your physician at age 50 and they get it year to year, they can track that and a rise of PSA just like they're going to track your cholesterol and other healthcare numbers. And then it's the trend that we really worry about. And the emphasis on screening is really getting the young guys in, and because prostate cancer is a heterogeneous disease. Much of it is slow growing, but there are some subsets of that which are very aggressive and unfortunately lead to death, and those are the people that we really want to get out and prevent.
Now, is there a known cause for prostate cancer?
Not really. It's a multifactorial. We know that it's interesting if you overlay the incidence of fat consumption in the world and the incidence of prostate cancer, those maps are almost identical. So we know that has a contributing factor. We know that family history is a strong contributing factor. And we're still trying to kind of find some of the other magic bullets that produce prostate cancer.
Now, you have to then step into the area of when someone does have the diagnosis of prostate cancer. There are a number of treatments for it.
There are, and we have anywhere from active surveillance, which we're doing more of now, and we've discovered that because some prostate cancer is not as aggressive, we can watch it. We have great molecular testing now that we can look at RNA and DNA, the building blocks of cancer, and go on to predict which of those cancers will be more aggressive. And for those who do need treatment, we have an array of treatments. We have surgical options. We have radiation therapy options, all of which I think we've made a great deal of progress in the last decade.
One of the things I have to ask you about, because it sounds so far out there to me, but I'm not a doctor. What do I know? Cyberknife. Now, I know you have a new facility in Norwood. That there's some facility. You have Cyberknife there?
We do. We're very proud to be able to bring that to Cincinnati, and that's basically a type of radiation therapy that really focuses on the prostate using robotic guidance technology, and we can actually do what's called hypofractionate the treatment, which means taking what ordinarily would be 7 weeks of radiation treatment and paring it down to 1 week with very, very good results.
You know, I know a bunch of guys that have obviously had some scares about prostate cancer, and a good friend of mine has been diagnosed with it just recently, and I said, what are you going to do about it? And I think one of the first things guys think about, and it's natural, is impotency. Is that still a big threat when you're treating that?
Well, sure. And erectile dysfunction and urinary control are some of the two major kind of issues that men deal with, and we're all concerned about that. Thankfully, some of the newer treatments really decrease some of those side effects going down the road.
All right. How long have you been in this new facility, by the way? I didn't ask you that.
Oh, gosh. Now you're testing me. Probably about 2.5 years, I think.
Yeah. 55,000 square feet?
It's quite large. We have 3 stories. We have pathology. We have radiology. We have imaging. We have our own surgery center. We see patients there. So it's really kind of a full service facility.
Indeed. A friend of mine had some surgery there, and he was very complimentary as well. Well, Doctor, I certainly appreciate you talking with us about being aware of prostate cancer. And that's, is there, like women can do self-examination for breast cancer and maybe alert a doctor, but for a man it's just the PSA, and that's the only way to go on that with warnings.
It is. I think, and I want to wish everybody a happy Father's Day out there, and I think the best gift that fathers can give to their family is to go out and get screened. We don't typically consume health care. Men don't. Women are advocates of that. And I think if guys go out there, get screened, it consists of a PSA blood test and a digital examination, and talk to your doctor about that. That's the best gift you can give to your family this Father's Day.